Well, our top focus story, Denmark, Norway and Iceland on Tuesday temporarily suspended the use of the AstraZeneca Oxford vaccine, which is known in India as the Covishield vaccine. Now, this over concerns of patients developing post-jab blood clots. Denmark was the first to announce a suspension after the country's health authority said that there were reports of serious cases of blood clots among people who had received the vaccine. After which, Norway and Iceland also have temporarily suspended the use of the vaccine. The UK Prime Minister, however, has defended, saying that the Oxford vaccine is safe. The AIMS director, speaking to NDTV, has also said that these blood clots could very much be coincidental. Well, what does this really mean for the world's race against coronavirus? We have with us Dr. Jerome Kim, Director General of the International Vaccine Institute, joining us. Thanks so much, Dr. Kim, for sparing the time and being with us. I want to first begin by asking you about the new concerns around the AstraZeneca vaccine. Do you think more research is perhaps needed? Is this a cause for concern?
No, I think that the Oxford AstraZeneca vaccine has been shown to be safe and effective in randomized clinical trials, which means that we've collected a lot of safety information and we really haven't seen the issue reported with blood clots. But as the AIMS director said, when you do a vaccination in populations which are elderly, you're going to see occurrence of blood clots naturally. And it's really going to be important for the countries that have suspended vaccination to look into the cases and for them to come to a determination whether they believe the vaccine is safe or not. Importantly, the European Regulatory Agency, the EMA, has come out with a statement saying, they believe that the vaccines are safe and efficacious, and but that they are willing to let the countries go on with their investigations.
Mm-hmm. Right. I want to also ask you about the other big question that's on everyone's mind, whether the existing coronavirus vaccines in the world market are effective against the variants, and if the vaccines do indeed need to be tweaked, when will we know?
Yes, so that's a really great question, and we ask ourselves that question every day. But I think that the bottom line is that for the variants that we know and the vaccines that we have, it appears that the vaccines are safe and effective in preventing disease from the variants, particularly the kinds of disease that result in severe infection, hospitalization, and death. But the data are still being generated. There are two vaccines in particular that have shown an impact, actual clinical trial impact in human subjects against the variants. That would be Johnson & Johnson and Novavax. We have other vaccines that appear to have evidence that they should protect when we do tests in a test tube. And we think that, for instance, the Pfizer vaccine and the Moderna vaccine, the AstraZeneca vaccine will have activity and do, in fact, prevent severe infection with the variant cases, but we just don't have as much information as we have with Johnson & Johnson and Novavax, which were actually tested in the sites that have the mutant viruses.
Do you believe, Dr. Kim, at the time when a lot of these vaccines were being developed, which is the course of the last 1 year, mutant strains was something perhaps that was not taken into consideration, or do virus mutations only emerge eventually, after which they are considered as far as vaccine development is concerned?
So we had always considered the amount of mutation that was going on in coronavirus strains to be important. In fact, in the beginning, actually in the early spring, a particular mutant took over the infections in Europe. So we knew that it could happen,
right?
But it looked like that mutant was going to be sensitive to the vaccine. I think that what may have happened is that during the summer and the fall in particular, as the third wave of outbreaks occurred, very, very substantial uncontrolled outbreaks are what drive mutation in the coronaviruses. So whenever you have these large explosive outbreaks, you're going to see mutations develop in the coronavirus strains that are circulating. The other important thing is there are parts of the world, in fact, the United States until recently was one of them, where we didn't really know what strains were circulating because they weren't keeping up with the viral sequences. They weren't able to tell us exactly
Right.
what the sequences were.
Right.
As the United States and other countries are now beginning to collect and analyze those, we'll have a much better picture about the emergence of coronavirus mutants. And this is very important. Now, rates of infection were starting to drop, and now in some countries they've started to increase again.
Yes.
We're really going to have to keep a close eye on the development of mutations. Again, vaccination is really important. As many people as possible, as soon as possible.
Yes.
But actually also masks and distancing are still going to be important
So
to
vaccine-
control spread and
Right.
control mutation.
Okay, so vaccines, masks and social distancing, all of those things are equally important. But you've also talked about the pace of vaccination. And I want to ask you, say as far as India is concerned, for instance, what can a country like India do to accelerate the pace of vaccination? Do you believe it needs to be more liberalized in terms of who can go out there and get vaccinated?
So I think that countries are making these decisions based on their own internal sets of priorities. Certainly people who are elderly and in nursing homes are at tremendous risk. It's very important to vaccinate healthcare workers because, again, they're on the front line fighting against the disease and taking care of patients. But as countries prioritize who needs to be vaccinated, they also at the same time have to ensure that the logistic systems are working, that our ability to keep the vaccine at the right temperature, for instance, is working, and that we have adequate numbers of trained personnel who can deliver those vaccines in campaign mode around the world. And so you saw what happened in the United States.
Right.
It was very slow at first, but they've now gotten much better at being
Yes.
able to distribute the vaccine and get it into people, and that's going to be critical. So if you look at most countries, they
Right.
start slow, and then they gradually ramp up, and hopefully India will do the same.
Okay, I'm completely out of time, but a very last question to you, Dr. Kim, is about, has other vaccinations suffered as a result of the COVID-19 vaccine, and how long will it take for the world to recover or catch up in those terms?
Yes, and so in fact, I think you're exactly right. We have some data that would suggest that routine vaccinations were put on hold, both vaccination campaigns in some countries, but also people were afraid to go to the doctor because, of course, that's a good way to catch COVID-19. So it will take a little bit of time as economies open up, as people get back to doing the things that they normally did. We are really going to have to launch campaigns to catch up. And this is critical. During the Ebola outbreak in the Democratic Republic of Congo, more children died of measles than of Ebola virus. So we can't let routine immunization slip. And, countries around the world are going to struggle to vaccinate everybody
Right.
for coronavirus. And then they're going to have to catch up for routine immunizations also.
Well,
Great point, ma'am.
Well, I think that's extremely crucial as well. Routine immunization, which has definitely suffered because of the COVID-19 vaccination program, is going to have to play catch up in the years to come. Thank you so much, Dr. Kim, for sparing your time and being with us on NDTV.
Thank you.
Well, I want to now shift our focus to the worrying India COVID story. And let's just look at the way the coronavirus numbers in India are looking at the moment. There have been 23,285 cases in the last 24 hours. This is the highest in over 2 months. The last time we saw such a spike in cases, this right here, was in fact back in December of 2019. I want to just break down for our viewers the India COVID curve as far as 2021 is concerned. This bell-shaped curve right here is a cause of concern because as you can see, the cases had dipped substantially towards the end of January, towards February. But once again, when you come and you look at March, and I'm just going to enhance this for our viewers to understand, you can see this uptick in COVID-19 cases, over 23,000 cases as of the last 24 hours. Let's also look at the states which are contributing to this rise in cases. As you can see, Maharashtra continues to remain the worst affected with over 14,300 cases in 24 hours, followed by Kerala, Punjab, Karnataka and Tamil Nadu. I want to also add here for our viewers that if you look at the difference between Tamil Nadu and say Madhya Pradesh and Delhi, the difference isn't much. Delhi is also seen over 400 cases in the last 24 hours. As far as Madhya Pradesh is concerned, it's also seen over 500 cases in the last 24 hours. So those are worrying worrying pictures at the moment. Remember, there's been a lockdown that's been announced in Nagpur. This is a district that's reported over 1,800 cases in the last 24 hours. And if you look at Maharashtra specifically, the Chief Minister of Maharashtra has said that there could very well be another lockdown if the cases continue to rise. I want to also point out to our viewers another worrying statistic that we're tracking, which is 8 of the 10 worst hit districts in the country currently are from Maharashtra. Pune, Nagpur, Thane, Mumbai, 4 of the top worst hit districts are from Maharashtra. Bengaluru urban and Ernakulam is also presenting itself a worrying story. One, of course, Kerala and one Karnataka. And again, if you look at this, the figures at the very end, Amravati, Jalgaon, Nasik and Aurangabad, all districts from Maharashtra that are in fact in the worst hit districts that we're looking at right now. I want to also highlight at the moment what the COVID-19 vaccine numbers are looking like. Look at this. So, 4 days ago, India had vaccinated 20 lakh people daily in one day. As opposed to, if you look at the figures right now, yesterday, 11th of March, in the last 24 hours, India has vaccinated 4.8 lakh. So, there has been, if you look at this graph right here, a slight dip as far as daily vaccination figures are concerned. This is a cause of concern as well, given the fact that India's COVID cases are rising. Also, there is a bit of a hit and miss as far as the targeted vaccination is concerned. Remember, India is looking to target 30 crore individuals by July. And if you do a bit of a back of the envelope calculation, we need to be vaccinating at least 50 lakh individuals on a daily basis in order to be able to meet that target. To talk more about the India COVID story, we have with us Dr. Sunila Garg. She needs no introduction. She is a member of ICMR, WHO, and also a member of the Delhi COVID Task Force and the India COVID Task Force. We have Dr. Rahul Pandit, member of the Maharashtra COVID Task Force. Thank you all very much for being with us. Dr. Pandit, if I can begin by asking you, Maharashtra is presenting itself as a worrying story. The government yesterday in the press conference has in fact come out and said that they are concerned about the spike in Maharashtra. What are we to make of the Maharashtra numbers?
Thank you very much for having me on your show. Indeed, Maharashtra is a concern right now. There are two distinct differences between Maharashtra. If you look at where is the urban population, which is Mumbai, Pune, Aurangabad cities, and then there is rest of the Maharashtra. And I think the cases in both the cases have risen simultaneously, but probably the reasons are a little bit different. In the rural areas such as Amravati, districts of Nagpur and talukas of Nagpur, probably there were large amounts of super spreader events. It started with the Gram Panchayat elections, and then the cases have slowly gone up. The contact tracing needs to be brought up, and there are some districts where the test positivity rate is around 15%, which is very high. So one thing is very clear that in the last 4 days, Maharashtra has stopped the number of cases, the test which they are doing, which is helping, and probably the numbers are now becoming more and more higher because we are doing a lot more tests. For example, Mumbai for last 2 weeks has been doing around 20 to 22,000 tests per day, and the test positivity rate is less than 5% on most days, except one day in between where it was 7%.
Right.
I think we need to increase our testing to bring down the test positivity rate. That will help us in identifying the patients who are positive, isolate them, if required, institutionally isolate them so that they don't go around mixing into the general population.
Right.
That has been another problem. If I may just take 1 more minute to explain. The patients who are asymptomatic, which is the case right now, most of the patients are asymptomatic. They are very difficult to contain in their home. So I think if they are not going to be basically contained in their home for a proper home quarantine in the true spirit, then we will have to institution quarantine for these people.
Very important point, Dr. Pandit. Very important point that you're making. You're actually saying that one of the strategies to contain the COVID numbers in Maharashtra could be mandatory institutional quarantine for anyone who tests COVID positive. Can we then, Dr. Garg, attribute perhaps this spike, and I know the government's denied it so far, denying any correlation, but in your assessment as an expert, would you say that the cases in select districts of Maharashtra are rising exponentially and this could be linked potentially to variant strains?
Yeah, that is one of the, it is one of the reasons. You see that there are mutant strains which are more infective in nature. Our borders are very porous, as we could see, more number of cases, in the Vidarbha district, we are seeing more number of cases in Thane and all of the different parts of Maharashtra. But at the same time, what I'll say is that along with that, we have, less of sanitization, social distancing and masking also. And night curfews are not going to help. That is one thing which is very, very important part, unless people are following appropriate COVID behaviors. So what you said very rightly is that we do have mutant strains which we cannot deny, which are more infectious but less severe. But the second part is also the people's behavior needs to be, kind of monitored. So that is another important part which we need to take into consideration.
It is a race between the virus and the vaccine, isn't it? Dr. Pandit, are you worried? There has been a slight dip in India's vaccination numbers. 4 days ago, we were vaccinating over 20 lakh people a day. That number is under 5 lakhs in the last 24 hours. Do you believe we are now, likely to miss the target that the government has set for July, which is 30 crore vaccinations?
So vaccination is as important as social distancing, masking and controlling of the pandemic, because it actually helps us into protecting our vulnerable group. So current target which we have, which is 45 plus comorbidities or 60 and above, is the population which is actually succumbing unfortunately whenever they have a COVID death. If you look at the COVID death analysis in Maharashtra, 80 to 90% of the people who unfortunately have died are in that category, who are above 60 or who have comorbidities. So if we vaccinate them as quickly as possible, we will be able to bring down the mortality. We need to save lives. Of course, we need to control the pandemic, bring the cases down, but we need to save life parallelly. Vaccinate 24/7, bring down the vaccine to the doorstep if we can.
Dr. Garg, vaccinate 24/7 is something that the government has asked private hospitals to do. But is it really happening, and what more needs to be done to accelerate the pace of vaccination in India?
I think it is very important at this stage to kind of address this issue of vaccine hesitancy across. And we need to focus, according to the states, according to the districts, this message, because we have got a very good communication strategy which works down from national level to the state level to the district level and to the block level. Today I went for second dose of vaccine and I could find not only what to talk of day and night, we are not only getting the, persons to get immunized in daytime also. This is, I'm talking of today itself. You see, when I went myself for that, the booth was just empty. So that's where we need to see that, how we can improve our communication strategy, and we do have a very good material and very innovative material which can be utilized, but it has to be left to states.
Well, a multi-pronged approach most definitely is needed to also inspire more confidence among people to go out and get vaccinated. Thank you both very much for joining us and sparing your time. We'll keep a close watch on all these developments. We're going to slip into a very short break, but coming up on the other side, we have a very special guest joining us from New York. Stay tuned. Welcome back. We have with us Diana Berendt, founder of Survivor Corps. It is one of the largest and fastest growing grassroots movements connecting and supporting COVID survivors in New York. Thanks for being with us. I want to begin by asking you, you're connected with COVID survivors. How big is the fear of reinfections? How many reinfections are you seeing because of COVID variants?
Correct. We have seen people get reinfected. Right now, we are not being told our exact genetic profile of our positive cases, but we are seeing about 10% of our membership is reporting reinfection. I think it's probably a bit lower than that in reality, but we are seeing much more reinfection within a number of months from first infection than we anticipated.
All right, and lingering and long hauler symptoms are emerging as an ongoing battle. Is this the new phenomena that we need to now be prepared for?
Oh, absolutely. We are seeing upwards of 1/3 of people who contract COVID developing long-term COVID. And what's most interesting is when we did research to look for the most predictive symptom, the symptom that would be most likely to show that you would develop long-term COVID, and it ended up being the people who were asymptomatic. So this is not something that is happening just to the people who are the sickest. In fact, it's happening to some of the people who are the least sick. And it is doing vascular and inflammatory damage to every organ in the body. People are really, really suffering. Although some, I'm happy to report, are actually finding relief after getting the vaccine. We're still doing research into that. Right now, it's still anecdotal data, but very interesting to follow.
Thanks so much, Diana, for joining us, and congratulations on all the good work that you're doing for COVID survivors there in New York. That's all the time we have for in this edition of Coronavirus Facts versus Myths. Thanks for watching.